Today we will be discussing questionnaire design. These slides were created by my good friend and colleague at the St. George's University in Grenada, Dr. Shelley Rodrigo. And I'll use them because I think they are quite useful for the purpose of teaching questionnaire design. By way of learning objectives, at the end of this lecture, each student should understand the distinction between the two types of questionnaires. Students should also recognize the key planning strategies for successful questionnaire design, recognize the key characteristics of well-designed questions, recognize three broad question types and when to use each of these type of questions, and finally, understand what different question types measure and the type of data that each of these questions may yield. Questionnaire design is very important when we think about collecting information on participants for research. While survey answers are not of interest intrinsically, the answers are important mainly because of their relationship to what they are supposed to help one measure. And so, question type and response options and formatting are something that the designer of a questionnaire should consider before designing the questions. So how the respondents interpret and respond to the question is going to be impacted by the type of questions and the response options, as well as how one design an on-screen data entry form or the data entry platform such as SPSS that is being used will all be impacted by the type of question and the response options. In creating our questionnaire, we must first identify the leading hypotheses about the source of the problem. And these we discussed in our last presentation on understanding hypotheses and variables. We must also identify the information needed to test the hypotheses, and these would be our variables. So what variables would we need in order to test our hypotheses? Once we've identified the variables, we need to identify the information needed for logistics of the study to examine confounding and for the analysis. So apart from the variables that measures our independent and our dependent variables, we must also consider our demographic and our extraneous variables as we would have discussed in our last presentation. Once we have done that, we need to write down the questions that we are going to use to collect this information. Organize the questions into a questionnaire format, test the questionnaire, which is also called piloting, and revise the questionnaire as a result of the information ascertained during piloting. If the questionnaire is to be administered by interviewers, then these interviewers need to be trained in order to understand the construct and the variables and what they are measuring based on the questionnaire. There are two main types of questionnaires that we use in epidemiological investigations. The first is our hypothesis generating questionnaire, and the second is our hypothesis testing questionnaire. In the next few slides, we will discuss which you should use and when. For hypothesis generating questionnaire, the targets is usually persons with a disease. The questions are primarily exploratory, and all possible risk factors are usually considered. It uses some open-ended questions, but can also use standardized questionnaire to guide interviews. For hypothesis testing, it looks on both healthy and ill persons, and the questions are usually targeted or specific. In this, we use specific suspected risk factors only. So we're looking at the independent variables that we think are related to our dependent variable or our outcome. So we're not considering all, we're considering ones that we know from our literature review already have a relationship with our outcome of interest. When we are testing an hypothesis, there's often limited use of open-ended questions, and the questions are more specific questions with options for specific responses. The investigation usually is determined by a specific questionnaire and not necessarily a standardized questionnaire to guide an interview, but rather a specific questionnaire. So, for example, if we wanted to assess a physical activity, there are specific questionnaires that we use to assess physical activity, such as the International Physical Activity Questionnaire. This is an example on your screen of a hypothesis generating questionnaire. As you can see, initially we ask, do you obtain drinking water from a municipal source? Yes or no. Did you consume any unusual food products in March or April that you do not normally eat? And that's an open-ended question. And that is followed by several other close-ended questions with specific options for the participant to choose. And in this example, we're simply exploring what might be the cause or the factors related to an outbreak that is being investigated. In this example of a hypothesis testing questionnaire, here we see specific questions with options that are specifically targeted to what we might suspect to be the source of the outbreak. So we're not exploring the many different options that exist in terms of the cause of an outbreak, but we have already suspected that this might be as a result of a particular baked goods, and so the question that is being asked in this hypothesis testing questionnaire are going to be specific to the suspected risk factor. Usually, when we are developing a questionnaire, there are some key categories of questions that must be considered. The first and most important of all of them is what we call the identifiers. And the identifier may be one or more unique identifying number or text that allows us to differentiate between two questionnaires from two different participants. The next set of questions are classified as demographic questions, and these questions focus mainly on the who of the participant: age, race, sex, religion, education, income, employment, etc. Then we might have our clinical data, and these are usually based on our dependent variables. So it might be that we're trying to assess obesity, and so we're looking at weight, we're looking at height as our outcome, we're looking at waist circumference, we are looking at waist hip ratio, and these would represent our clinical data. If we believe that our exposure or risk factors may be physical activity and diet, then our exposure or risk factor questions would be based on diet and physical activity. And then the source of information is always important. Are we ascertaining this information directly from the participant, or is this information secondary based on medical records or even by an informant like the parents of children who are underage? So again, just to go into detail on the identifiers, they are again respondent's name or other identifiers, their contact information such as address and telephone number. And this information is usually sensitive information that cannot be displayed along with the data. And so they're kept separately, mainly because of privacy issues and securing confidential information of your participants. But in the case where you have collected information and you have identified a problem with one of the participants and need to contact them, then their records should have some linkage to their identifying information so that they can be contacted by specific individuals in the research study. So though we try our utmost best to keep patient or participant information confidential, there must be a link to the information collected and the participants so that they can be contacted should there be an emergency or should there be unearthing of information that is putting the participant at risk in terms of their health. So some examples again, as I've said, of demographics is age, gender, education, or location, and they're used primarily to characterize the population at risk. They need to be evaluated to determine if the affects the relationship between our independent variable and our outcome variable, also called our exposure and disease here. And they're important in the search for what we'd consider potential confounders. Again, clinical data, mainly on our outcome. So the signs and symptoms of the disease, date of the onset of illness, the results of laboratory testing, measurement taken on the body, such as height, such as weight, as I've said before. And this allows us to characterize the condition or illness, to decide who has the outcome of interest, and to chart the time course of the problem, particularly if we're looking at an outbreak investigation. Exposures or risk factors, again, these are what we'd consider our independent variables that lead to a change in our outcome, and they often include the exposure to a factor of interest, the route, the amount, the timing of the exposure, and other details of the exposure. Who is supplying the information? This helps us to assess the validity. Is the interviewee the study subject, or is this a surrogate? As I've said before, could this be the mother, or could this be secondary information as given by an eyewitness to an account? It also helps to identify who is collecting the data. Because if we identify who is collecting the data in the form of the interviewer, then if there are any problems with the data that is collected, such as handwriting, legibility, or incorrect entry, then that person can be contacted to clarify what was meant. We'll now take a look at question design. There are some key elements of a good question. These include reliability, validity, specificity versus ambiguity, simplicity, ensuring that one question is asked, mutually exclusive answer choices, and refers respondents to specific date, times for recall. We're going to take a look at the first three, and then we'll take a break, and we will take up the next part of this presentation in another lecture. In terms of reliability, we're looking to see if the question is designed to be reliable, because this will assure us that the words are interpreted the same way in any setting and by each participant that is answering the question. So you want to make sure that the question is understood and answered in a similar way based on how it is constructed by each participant. An example of a reliable question, or rather one that might not be reliable, is, are you experiencing diarrhea? In and of itself, this question is not very reliable. If the interviewer, however, adds that for the purpose of this survey, we consider diarrhea to be 3 or more loose bowel movements in a 24-hour period, then each time the question is being asked, the definition is the same, and therefore we would most likely get the correct response to the question, are you experiencing diarrhea? The second issue is validity. A question that is usually designed to be valid will always yield information that is used to be a true measure of what the researcher is looking for. Let's look at an example. This is one that is less useful. Which is your source of drinking water at home? The options here could be given tap water or bottled water. Think about it for a minute if this is a very valid question. I suppose some of you are saying, no, it's not very valid. And the reason is because at home, you might put your tap water in a bottle and drink your tap water from a bottle. And so your tap water, in a sense, is also the same as your bottled water. What would be better? It would be better if we said, which is your source of drinking water at home? Municipal tap water with additional filtration, well water, or commercially bottled water. And this gives the question greater validity because we are sure that what we are getting back as a response is what the researcher is looking for. The last criteria or component of a good question that we will look on in this section of our presentation is ambiguity. If we ask the participant, when did you have disease X? The individual may interpret this question to mean at what age, at what time, at what year, in what month. However, if we ask, how old were you when you have the disease or had the disease, then that's a more specific question and less ambiguous. Let's look at the second example. Have you ever been examined by a physician in the past 7 days? An individual might have gone to one or more or two or more physicians in the last 7 days. And so if it is that we are asking about examination for a specific symptom, then we need to ask that exactly. And so if you look to the right of your screen, you will see that a better way to phrase that question to avoid ambiguity is to ask, have you ever been examined by a physician for these symptoms in the past 7 days? And so making our question clear and